Dr. Vandenbroucke, welcome to Contagion.
Thank you. Glad to be here.
So, can you just introduce us to the topic and a bit about your own background?
Yes. So I'm the Chief Medical Officer for Pfizer's hospital business unit, which includes all of Pfizer's 80 anti-infectives that we currently have on the market, as well as the development of new antibiotics and antifungals. And so I'm a physician by training, and I've been working in this for a very long time, and it's really a passion of mine. So antimicrobial resistance is a problem that is rising, and it's already a very important problem. About 700,000 people die each year around the world due to antimicrobial resistance. But there's a projection that by 2050, that number could increase to about 10 million, which is actually more people that actually die today due to cancers. And so it's a growing problem. It's a very important problem and a problem that needs to be addressed.
So in terms of excess death, if the antimicrobial resistance threat just continues unabated, we're looking at something like the burden of another cancer, just purely in terms of mortality. Is that what you're saying?
We're looking at the total burden of cancer, not just one particular type of cancer, but the total burden of cancer, if that projection becomes true. So it's a very important problem that needs to be addressed now.
I know people tend to be aware of when your doctor prescribes you antibiotics. There's different guidance on that. So there's some surface level awareness on the part of the public. I don't think it's disinterest, but are we looking at a potential future where something like a scrape or a cut can be deadly once again in ways that haven't been true for at least 50 years?
Yes, exactly. So antibiotics have been really wonder drugs over the past century. And so they have really changed the face of infectious disease. And so if we go back to a world where antibiotics don't work anymore because of the rising resistance, we go back to a world where exactly a little scrape can actually be deadly, where a lot of elective surgery or a lot of non-elective surgery would be simply impossible because we would not have effective antibiotic coverage. It would also have a very important impact on travel, for instance, because as we can see, COVID-19 is actually a very interesting analog of this, right? It really shows us that when there is infectious disease for which we don't have effective treatment, what can happen and how that can affect people's lives beyond those people that actually get infected. It affects people's lives in terms of travel, in terms of work, in terms of meeting with family and friends. And so it would really imply a major change in how we live and have also a major economic impact, by the way, as well.